Hi, I'm Elizabeth Zhang, and I am a board certified ophthalmologist practicing in Cleveland, Ohio. So, one common question I get asked is exactly what are cataracts? A cataract is when the lens in your eye becomes not clear. And so it becomes more opaque, and this can make it so less light comes in or it can blur your vision. So the lens in your eye focuses light. It's one of the multiple things that cause light to focus onto the back of the eye, which is the retina. And the retina is what detects light and sends that information to the brain so that you can see. So that lens focuses, and when you're first born, it's actually usually clear, but there are children who are actually born with cataracts, and that needs to be addressed when they're a child. Otherwise, they'll never learn to develop well. But we're going to talk about the kind of cataracts that people get when they're older. So if you're born with a clear lens, that lens actually grows throughout our lifetime. And as you add more layers on, it's going to become a little less clear. If you just think about thin glass versus really thick glass, even clear, really thick glass just doesn't seem as clear as clear thin glass. As you add on these layers, again, so it becomes a little less clear and usually becomes a little bit more yellow with time. And depending on what medications you take or what kind of health circumstances you may have, other opacities can actually get incorporated in that lens as it grows. So typically I tell most of my patients that by the time you're 60, you probably have some amount of cataract. UV light also contributes to cataracts. Like I said, certain medications like prednisone can cause more cataracts, and certain health issues like diabetes can also contribute to cataracts. With diabetes, if your blood sugars are really high, that sugar will actually enter the lens. And when the sugar goes low, it exits that lens. And it's likely that that process also contributes to cataract formation. So there are different kinds, what we call different kinds of cataracts, and that's really just addressing the different colorations that I as an ophthalmologist see when I'm looking at your eyes. So there's nuclear sclerosis, which is really just the yellowing of the cataract. Choroidal cataracts are more of a white color. There's posterior subcapsular cataracts. That's really opacity at the very posterior backside of the lens. But these things all don't necessarily matter to you as a patient. Really, the cure for cataracts is just cataract surgery. We take out the lens and then we put in a clear new implant in its place, and that implant will stay in for the rest of your life. Cataract surgery is one of the most commonly performed surgeries in the United States. And pretty much anyone who lives old enough is eventually going to get a cataract. So if you're noticing that your vision's starting to get more blurry, it also may cause glare. So some cataracts cause the light to scatter more when you actually look around. So especially when you're having like a bright light in the dark, so headlights at night can cause a lot of glare, or maybe looking at screens like televisions or your phone can cause more glare. So if you're having a lot of issues with glare or blurred vision, please make an appointment to see your local ophthalmologist in order to evaluate for cataracts. Well, like I said, most people have developed some amount of cataracts in their 60s. Some people don't end up having cataract surgery until their 80s, but there's also people who end up having cataract surgery in their 40s and 50s. So it can be a large range. I hope you found this information useful. If you have, please subscribe to this channel for more information. If you're in the Cleveland area, I'd love to see you as a patient. Thank you.